This is a PowerPoint that just goes over guide and how it can improve outcomes not only for patients and their caregivers, but also for health professionals, and just to kind of explain to them why our program is something that they would want to incorporate with their patients and why they would want to collaborate with us as well. I'm Kelly Zolman. I am the nurse practitioner for the program. We are currently in the process of onboarding five more NPs to join our team as well. Quick overview what Guide is. It's an innovative program for individuals with dementia. Uh, One of the important parts about our program is that we view the patient as well as the caregiver as one unit together. So we work not only to help the patient, but also to help the caregiver. The program focuses on improving quality of life for the patient with the dementia, as well as improving the quality of life for their caregiver, because Medicare is understanding that it's not just the patient who is impacted on a dementia journey, it's also the people that are taking care of them. Some unique features of our program: this is a Medicare funded program through CS. You do have to have traditional Medicare to be on the program. We do not accept any Advantage plans at this time, although we are hoping that that will change in the future. It includes some additional respite benefits for patients that are severe enough on the FAST scale. If they are a 5 or greater on the FAST scale, they can qualify for the respite benefit to help provide caregivers for the patient so that the primary caregiver, their family member, could have a break. Like I said before, it is unique in the fact that it offers benefits to both the patient with dementia as well as their caregiver. We do have a clinic space here in Fort Wayne. It is currently on Lake Avenue, although that is pending location. We may be moving out back to our West Jefferson location. And then we also do telehealth visits. We cover the full state of Indiana, and we are starting to go into Ohio as well. So lots of our visits are telehealth, and we have starting to really been able to impact people that are outside of Fort Wayne through our program, which is wonderful. The guide team, we have added quite a few members recently. We have our clinic manager, and she oversees the day-to-day operations at the guide clinic, managing all the staff that we have over there, including our care navigators. She does lots of different things for us with billing. And then she supervises all non-clinical staff. Then we have our medical director. His name is Dr. Jaiswal. He has been wonderful. He supports the nurse practitioners with the program, collaborates with us, just making sure that we are overseeing our patients to the best of our ability. And then we have the nurse, myself, our nurse practitioner, and we will have five more. Like I previously stated, we are the ones that are primarily interacting with the patients and the family members, and just making sure that they are safe, also attesting to their dementia diagnoses, getting them onto the program, doing that initial assessment. And we also can do medication management for them if they need anything that falls under the realm of dementia management. So, whether that be anxiety, depression, agitation, um, insomnia, behaviors, lots of different things that we can help them with. On site, we also have uh, services for UTI testing as well, which has been nice for our families. We also do medication reviews, and then we collaborate as well with their healthcare providers after visits. We have a care navigator who is the primary point of contact for our patients' caregivers. They are speaking with them at least monthly, doing non clinical assessments, seeing how their caregiver is doing. And they assist with getting the family any sort of benefits or resources that they need through our program, and then just provide that ongoing support. They're always there. Family members need to call into our clinic, ask questions about, if their loved one is having a really bad day and they're just hitting a lot of roadblocks as a caregiver and they're not sure who to call. We are always there, and it is free through our program. So they're never charged for any of their visits with us as long as it falls under the guide model. And then we do have a clinic support specialist. She's also our medical assistant, and she provides support and check in, check out for our patients, lots of communication with the family. Kind of acts as our clinic nurse. She does lots of screening, scheduling, appointments, registration as well. So she's kind of our jack of all trades. She's wonderful. And then here are the guide benefits for clinicians and care teams and why collaborating with us can just really help round out your patient's care even more. So, Guide, we do operate on an evidence-based model for delivering comprehensive care. And it just allows us to be able to collaborate effectively with other doctors, PAs, NPs, anybody who's seeing our patients as well. One of the biggest parts of our program is that we've been able to reduce patients' needs for acute care. And Medicare loves that because that lowers the total cost of Medicare dollars that are going out the window. If we can minimize trips to the ER by being a resource and being available for our patients and their families, then that is a benefit to the Medicare system. That is a benefit to our patients and their loved ones and their time and their money and their stress, as well as just helping to keep the patient at home and out of the hospital if necessary and safe to do so. So, we can help prevent those things by being proactive with our monitoring and management of their dementia. We're having rather consistent communication with our patients and their caregivers. So if we can try to be on top of things or ahead of some symptoms that we think may be popping up, especially with agitation and things like that, then we can help prevent some of those trips. Again, with our medication reconciliation, that can also be a big one if we identify that a patient is on a medication that is unsafe or not needed, or maybe they have a medication that could help benefit them. We can help with those things. We also have quick access to telehealth. So if somebody needs to be seen that day for um, some really bad agitation or anxiety or anger, we can see them and see if it's appropriate for us to send out a medication for them or not and kind of see what's going on. And we also can help prevent any acute care visits by providing lots and lots of education to the caregiver so that they can know what to expect in this process and in this dementia journey. And for them to maybe not panic as much and not feel that they need to present to the emergency rooms and things like that with their loved one. And just like I said, early intervention, trying to get on top of things before they happen is one of the biggest ways we can reduce that burden. All right. And then we have improved care coordination and continuity of care. So, um, the guide model supports coordination through primary care, specialty care, behavioral care, neurology, psych. So we just make sure that we are constantly communicating with our patients' PCPs, with their psychiatrists, with their neurologists to let them know, hey, they're on the program. And also, if they find that their patient and their caregiver is having a hard time, then they know they can refer them back to us and say, hey, why don't you reach out to the guide, see if they have any references, any resources for you. So we are always a good fallback as well for other providers to know that we are here to support them, because sometimes I feel other providers may not know what always they can do for their patients because sometimes they only have so many things, so many resources they can offer them. And particularly given the fact that our program is free. And any notes after visits are sent over to the patient's PCPs. They're either faxed or sent through Epic. And then also, if we do identify anything during the visit that does not fall under our scope, we will always refer them back to their PCP for any needs. Okay, so caregiver engagement and support. What benefits do the caregivers receive for our patients on Guide? Caregivers have regular caregiver assessments that are done by the care navigators to help determine the level of stress that our caregivers are feeling. If those levels of stress are going up, we start talking about what has changed, what's going on at home. How are the medications working? Do you need to talk with our NPs to figure something out, or do you need to go to your neurologist, whoever they need or want to follow up with? And they have that monthly contact with the care navigator. That we also provide the ongoing caregiver education. So every time we talk to them, we are educating them on something, whatever they said that they're struggling with that month. We are providing education to help them manage that from home. They also have 24/7 access to support. So we do have a 24/7 after hours line. This is not an acute or emergent line. This is for caregiver support. If they are, someone's up in the middle of the night with their loved one and they just feel like they're at their wits' end as a caregiver, they don't know what to do for them. As long as it is not a medical emergency, it's more of a caregiving emergency, they can call this line to get support from guide staff. Additional things that we can offer for support through aging and in-home services would be home delivered meals for our families, some public transportation. There's different home modification programs that we make referrals to. And then there's also respite services that I talked about earlier that the guide program can provide for individuals who qualify for our respite uh, services. And the hope is that this all can help lead to fewer crises that the caregivers will encounter while caring for their loved one. And our program supports underserved populations. A lot of people with dementia feel like they're diagnosed and then they're kind of sent back home in the meantime and they're not sure what to do. So, with our program being free through their insurance, we are able to provide almost endless services for these people with no cost to them so that they can feel supported and maintained during this journey and to know that they always have somebody to reach out to. It's very easy for families and patients who have dementia to kind of fall through those cracks. So we are really proud of that with our program that we are able to support people like this. We also have improved professional satisfaction just by being very um, on top of things with our patients and their family, um, and then also communicating with other medical staff as well. And then our program is financially sustainable and it's very predictable in terms of charges, which they should not be charged as long as everything falls under guide. And it's as long as people are on traditional Medicare, they are going to have access to our program as long as they have dementia. So it is again just a great resource for people that I feel like has been missing in our healthcare system for a long time. Um, and like I said, if eligible, people get that respite benefit. That's $2,568 per year to use towards respite services. And that is huge. I know a lot of patients upon discharge in the hospital from an admission with agitation, family feels like, how are we going to bring them home? How are we going to maintain them at home? And a lot of times I think on that discharge, the case managers there, they'll give them information for here's home health services, but most of those are not covered by insurance or, private pay. And it's very hard for people to be able to do anything like that long term. So at least families know that every year they will be getting this budget while they are on the program, as long as they are a fast of five. They will be getting this budget to put towards supporting their loved one at home and helping the caregiver get a break. And then, for anybody that is watching this that is unaware of how to make a guide referral, we do not need a formal referral. They can be emailed in, called in. We do have a form as well. If you want to fill it out, we can email back to you. We just ask that we have the individual's Medicare number or their social security number, and we can make sure they have the right insurance. And we reach out within a day or two to just let everybody know. If they qualify and then get next steps going for them. If anybody has any questions about this presentation or about guide, as well as just different things that we can do in terms of collaborating with other healthcare professionals, please send any questions to our email on the screen, guide@agingihs.org, and we will answer any questions and get you in contact with who you need to speak with. And then this is just a little picture of our current clinic um, off of Lake. And I really appreciate everybody's time and listening to this video. Again, if you have any questions, feel free to reach out. Other than that, have a great day.